what's been the controversy around HRT?
Well, I'll tell you what's not controversial, what's now called menopause hormone therapy, MHT, because it's not quite replacement therapy. But what's not controversial is that it helps the symptoms of menopause, particularly hot flashes, but sleep problems with sleep, sweating in bed at night, and so on. Mood changes. That hormone therapy can actually help that. What's been controversial is whether there are any harms attached to that. And over the years, the research has not been that great into this type of treatment, which is needed by so many women. And there was a huge trial 20 or maybe 30 years ago, 60,000 women, unfortunately was into the wrong group of women. They were older than most women who take menopause treatment take it in their 50s. This was women in their 60s who were already at a higher risk of heart disease and breast cancer and things like that. And that showed a higher risk, particularly of breast cancer. And it put women off and doctors off. And a lot of women have been suffering. And they're coming back realizing that the risks are manageable and low. There's been an outstanding question about coronary heart disease, heart attacks, strokes, and particularly thrombosis with menopause hormone treatment. Some trials showed there have been effects and increased risk, some not. This most recent study is from Sweden in 900,000 women, looking at women who started various types of hormone replacement therapy, including the latest forms, more recent forms, which are patches or gels that you put on your skin. And what it showed, and there are problems with this research, so the main reason for talking to you about it is that women might read about it and get worried. But anyway, what it showed was that the older oral forms of combined hormone treatment were associated with increased risks of heart attack, stroke, and thrombosis. And the new transdermal patches were not. They did not affect your coronary risk. But there are lots of problems with this study, and it's very hard to say that to assume that the results are real. What's much more reassuring for women, well, first of all, that's reassuring for women that transdermal's fine, is a study of women actually age 60 and over, because there's no magic point at 59 where you're suddenly going to stop your treatment because you happen to be 59. Many women want and need the treatment to go beyond that. And what that found, they studied women over 60 who are at risk of heart disease to start with. And if there was going to be an effective hormone treatment, it's going to be in that group of women. And what that study showed, which was a review of all the evidence, was there was no increased risk in coronary heart disease, regardless of preparation. So women can relax a bit that the risk, at least when it comes to coronary heart disease, stroke, thrombosis, is actually not there. What's not true is that there's any protective effect. It doesn't lower your risk of coronary heart disease, so there's no getting out of jail here for eating healthily, getting exercise and not smoking, but at least it doesn't raise it.
Okay, and these skin patches, that's what's most commonly used now? That's
right, and the problem at the moment is they're in short supply, along with a few other drugs around, and it's not entirely clear when they'll come back on stream. But according to this study, if you needed to take oral treatment for a while until they do come back on stream in terms of supply, there's global problems with all sorts of drugs at the moment, then you could do so. But you've got to talk to a real doctor, not just a media doctor like me.
You are a real doctor, no? You're Dr. Norman Swan. Just before you go then, you've been looking this week at whether collagen supplements work.
Yeah, I mean, people make a fortune out of this. Just look, the eye-watering costs when you go into one of these cosmetic stores. Collagen holds our body together. There's 28 forms of collagen. The ones that most people are worried about is under your skin, because the cells that produce collagen, there's not so many of them as you get older. If you've smoked, if you've got sun damage, there's even fewer, and they lower production. And in theory, if you take whole collagen, your body just breaks it down. So there's not much benefit from that. But maybe some of the precursors that make collagen could work. But the reality is a healthy diet, egg whites, foods low in vitamin C, garlic can help produce more collagen. What does that sound like? Mediterranean diet.
You can't get away from the old advice, can you? Eat healthily and exercise.
And exercise, because mechanical stimulation does help collagen production.